Primate's World Relief and Development Fund is the Anglican Church of Canada's agency for sustainable development and relief across the world.
I think what makes the work of PWRDF effective is two things. First of all, our capacity through Primate's World Relief and Development Fund to respond quickly to emergency situations. We have a humanitarian emergencies coordinator who quickly networks across the country, and within hours Anglicans are responding to the situation. Secondly, I would cite our commitment to long-term development. And that commitment is based in partnerships. And the basic principle is we listen, we learn, and then we act together.
One of the partnerships is with SALAMA in Malema in rural Mozambique.
Rural communities in Mozambique face most of health issues connected to high levels of poverty, lack of infrastructure, health services. So most of those diseases are connected to malnutrition, to malaria, low levels of sanitation. SALAMA is an organization that is rooted in the community. I would say that 70–80% of the people that they work with, the activists, the trainers, are members of the community. SALAMA also has the know-how. It's an organization that is very skilled in what they do. They also are very effective and efficient in delivering health services.
With SALAMA, PWRDF is delivering a whole range of mother and child health programs. Here at this clinic, couples can receive family planning advice.
This program helps us to get knowledge in family planning methods. It helps us to have planned pregnancies and has improved general well-being in our family.
Healthcare programs are delivered through local community workers.
Health workers are important in communities because they are major players in community health. They are the ones trusted by the communities in these issues. That's why SALAMA chooses them from the communities, so that should we move out, their work could continue.
Local people deliver programs on improving nutrition.
I thank SALAMA because the children are improving in health from the porridge that we prepare, and even my child, who was thin, is getting bigger and growing well.
In this area, many people live over 50 kilometres from the nearest clinic. Mother-in-waiting houses have been built to house women in the weeks before delivery.
I'm here to have better care. When I deliver, I will have a healthier and safer delivery.
Bicycle ambulances have also been introduced to support communities living in remote and inaccessible areas.
Those ambulances are in the community. We distribute them to the community. They are property of the community. The community take ownership and they administrate it. But they are very efficient because they can go to very remote areas and bring to the nearest hospital or clinic people that are sick and would have to walk to the nearest hospital or clinic.
Together with SALAMA, we have had a greater impact with community involvement. It has helped build a better relationship with the community. SALAMA has helped in building these healthcare centres, thereby reducing the distances to the clinics, in particular for people living in remote areas.
In areas where SALAMA intervenes, there is an increasing number of people beginning to access to the health services that clinics and hospitals offer. And again, because all education of the community is made through people that they trust, the community health workers, they are more willing to really put aside their cultural beliefs and come to the clinic. So yes, I can say that we have seen improvement in terms of numbers of people seeking the best care that they can have.